Good morning and welcome to IHAN. Thank you so much for joining us, and I really wanted to give you that warm welcome. I'm looking forward to making a little bit of an update here so that you have some context in which to enter the spaces that we're in. I am the medical director and co-founder at Integrative Health Action Network. We have been doing this for about 10 seasons now, 10 years. And I wanted to share a little bit about how things have evolved in the environmental medicine portion and world of this as we go into disaster response. I am currently in the process of updating our training videos for naturopathic doctors, medical doctors, DOs, nurses, and I have not completed that yet as we go into another disaster response, so this will serve as a bridge. So as you arrive into disaster response, our team will have a space set up. Very often that space is outdoors or partially outdoors in an apparatus bay in a firehouse or at a base camp. And because of that, I want you to be aware of your own safety first. There's usually obviously some air quality issues, and the current response that we're going into, last I checked, the AQI was hovering between 150 and 200. We will have KN95 masks available for you. I encourage you to wear them whenever you can. I will also just let you know it can be really challenging as you're having communication with people to consistently keep it on sometimes. And so please make yourself available to make sure you're receiving some treatment at these clinics as well. Please know that that is available to you. So as you go into these clinics, as far as the naturopathic medicine, functional medicine component of these clinics, what we are usually operating under is nebulized glutathione treatments. Sometimes intravenous glutathione treatments. It really depends on the space and if we feel safe doing that and the individuals there, as well as supplementation that we have donated. And so we're providing consults. Usually, besides cough, it's shortness of breath. The main things that we are seeing is difficulty with sleeping. People are out of their routine. They're on different schedules. They're sleeping sometimes on the ground in a very noisy place. It can be sometimes, so trouble with sleep. Sometimes GI issues come up because there's such close quarters. So we watch for that and make sure that we're catching anything that is disseminating through a base camp very quickly and reporting that back. As well as fatigue, brain fog, and a big one, you'll see a lot of videos. I really encourage you, even if it's a last minute sign up, please make sure you review our videos on stabilization and trauma and PTSD. As we move into more intensive fires and kind of compounded back to back like this, we hear, of course, more frequently from firefighters that they're facing a lot of PTSD as they enter these situations. A lot of times, sometimes it's their community that is burning. Sometimes they are having PTSD from a recent fire where their community did burn, and then they show up into a place where it appears very similar and they're having a lot of challenge with that. So please make sure you review the trauma and stabilization videos on our website. They're very, very important. I think if I zoom out here a little bit, one of the most important things to consider is that this is not your day-to-day practice. This is different. The way that we treat people is different. The considerations are significantly different. You may never see these people again. It's very likely that you won't see them again, many of them. And so everything that we do, we have to keep that in mind. When you are prescribing supplements, you need to keep that in mind. When we're providing IVs, we need to keep that in mind. There is often through incident command or through the fire stations, a way for people to get a hold of us if there is an urgent concern that comes up. But people often won't if it's not emergent or urgent. So please keep that in mind as you are practicing. As an infrastructure IHAN provides all of the supplies that you should need. If there is something very particular to the way that you practice, and you'd like to provide another service, please check in with the medical lead and make sure that it's appropriate at that location at that time. But we will provide nebulized glutathione, as well as all the supplies to nebulize for folks. We will provide intravenous glutathione and all of the intravenous supplies. We will supply supplements that have been donated as well. Absolutely, again, if you have some sort of a connection that's helpful, please reach out to us so that we can ensure that we're not oversupplying and we don't have leftover supply, or that it's not something that, based on our experience, we think would be challenging in that environment. In addition, in most places, you're welcome to provide physical medicine services. One thing that I forgot to mention earlier is that pain is a really big component of what we see at the clinics as well. Hard, grueling work. There's very hard, grueling work often on these fires, and people are working sometimes for 24 to 36 hours straight or more. In some cases, like in the Eaton and Palisades, there were reports of people working 72 hours at a time. So physical medicine services can be very, very helpful as well. In addition to the supplies that we provide, excuse me, we will provide consent forms that we will make sure get back to you. We will provide a charting form, and those both require a HIPAA compliant email. So if you are not sure if your email is HIPAA compliant, you can certainly check with us, but that requires that you do not have an @Gmail account, that it's at maybe your business name, for example, and that you have signed a BAA with Google. If that's not something that you've done and you use it for business, it's a great step to take anyways, is to have a BAA signed with Google on your business account. We will, once we have that HIPAA compliant email, I will send out a charting form for you. And the idea is to make a copy of that form that I send you and then populate all of the responses into forms. You can also additionally go through and pre-click and pre-fill all of the responses and then change them as needed. And that just makes it very expedient in your charting process. We have on-site SOPs for glutathione, both nebulization and intravenous use. So please take a look at those when you arrive, and please know where your medical lead is. At the beginning of shifts, we will make sure that we go over, the medical lead and the administrative team will go over where all of the emergency supplies are, who we're treating that day, any special considerations, and what's available for you to utilize. A couple of reminders: please operate, 1, of course, under the scope of your license, and 2, within your capacity. If you haven't started a line on someone since med school, please go ahead and nebulize folks or do consults or work in pain or whatever your specialty is that you can provide. We are very specially and specifically suited for this work. I encourage you to make sure that you are grounding yourself before you enter and taking care of your own physical and mental health. If you find that you need breaks, please take them. It will often seem like there is a never-ending stream of individuals to be treated. That is just part of this work, and it doesn't mean that we shouldn't take breaks and take care of ourselves. In fact, the opposite is true. Please make sure to stop and take care of yourselves. Our administrative team will be checking in with individuals as well to make sure on our team that you are feeling like you've had a bathroom break and that you've had something to eat, and that you don't feel like you need to go home. But that responsibility ultimately is in your hands to let us know what you need. If you've reached this point, you've probably gone through the validation process in our streamlined process as far as malpractice verification, license verification. You may be in the middle of background check verification right now, or it may be complete. All of those things need to be completed by the time that you volunteer with us. And so we thank you for your willingness to volunteer. I think you will, hopefully, as I have, find this work to be incredibly meaningful. And we hope that it brings some peace to you as well as it has for us to be able to give back in this great time of need. Thanks.